Okay, I'll go ahead and start. So again, hi, my name is Maureen, and I'm going to take you through some of the efforts that I'm putting together in uncovering the uncertainty and confusion surrounding different aspects of COVID-19. And I hope you enjoy this. So why did I choose this topic? In today's era, you and I, and pretty much everyone is a creator of information. Unfortunately, this has caused a lot of inaccurate, baseless information circulating on social media, creating a high potential of misleading people. In fact, there is a lot of uncertainty and confusion surrounding the symptoms, the causes, and even the treatment of COVID-19. So now as we face this medical emergency, misinformation about the novel coronavirus can be really dangerous, as it can undermine the efforts being implemented to prevent its spread or even reduce its impact. And that is what my motivation really was for this brief work that I am going to take you through. So having realized that, I started thinking, well, how would we combat such an issue if there is a bit of confusion in the community, in the people? How are we going to know what these are? And so the first thing that came to mind, as you may have thought already, is we need to know what the people are not sure about. And we probably also need to understand what are some of the misinformation that is making rounds on our different social media platforms. The next step was, where would we get such information? And it was sort of easy. We all know for sure that if people are searching and asking questions about something, and that means there is missing information in regards to that topic. And so that I'm going to show you is data from a few search engines and as I will also show you in my ongoing work and next steps is also to identify more data sources. So what I'm doing right now is I'm doing data mining and exploration to uncover insights into areas that are still unclear to the public about the novel coronavirus. Now, if I was to paint a scenario here, when you're unsure about something, when people are searching about things that they don't know about, they will use words like how, what. Visualization that I am going to show you is an example of an analysis that I've done just using a simple keyword query. The data source is from answerthepublic.com. I'll put the link up there. I will share it in details later. The public it's a free keyword search tool that allows you to export to a CSV Excel file, and can also create a bit of search engines that powers it are Google and Bing. So what you're looking at is just a few searches that have come up from the keyword queries that I came up with. So if we take an example of wheel, people are asking, my internet is stable. Can you hear me?
Yes, we can hear you. You go off and come
You're
back.
breaking.
Oh, too bad. Okay, sorry. So what I'm saying is the example that you're looking at right now is data that is picked from a tool or a platform called answerthepublic.com. These guys have data from Bing and Google, and they give you access to it, and you can download it as an Excel or even visualize within their tool. So what you're looking at is, I'm sure you've already read some of the questions that people are asking is, will COVID-19 kill me, or will COVID-19 end in summer? Or if we go to can, you can see that, can COVID-19 survive in heat? Can survive heat? Can COVID-19 survive in water? If you pay attention, especially to the ones that are marked in red, issues that people are asking about. Let me give you even another example. If we look at why, can remove this. Okay, so if we look at why, asking why COVID-19 is worse than the flu, which is a genuine question, because we've always gotten flu, and someone might be wondering, okay, what is, the big deal about this COVID-19? What makes it worse than the flu? And someone asking that means that, not actually someone, because it's a compilation how many times some of these questions have come up. If you notice that the circles are greener on top and lighter at the bottom, which shows that there are more questions coming up, for example, with a why COVID-19 is worse than the flu, compared to why COVID-19 is dangerous. So just circles, they are greener. The greener it is means that that question has been asked quite a number of times. Same example goes even for what COVID-19 feels like, what COVID-19 does to the body. And insight to areas where people could use a bit more of sensitization and can even advise or get resources appropriate. Maybe resources should be allocated. It gives the insight into what people actually are looking for out there. I went ahead and carried out a detailed analysis on the coronavirus as a keyword. And what you can see there is just a summary of almost everything that comes up. And you'll have examples like, a lot is said of sick they are taken to, is being given to these people. The next one that is also marked red is why coronavirus is called novel. People are looking for information about all sorts of things. Why coronavirus is deadly, or are coronavirus and COVID-19 the same? This kind of analysis helps you uncover some bits of confusion that you didn't even think were confusion to begin with. Like, you would think no one, like everyone knows that these two are related, coronavirus and COVID, but then you find someone has no idea, and they may be saying, okay, maybe those are two different, that both work that I get into, just looking at what people do about. Now, what I try to monitor are the same questions coming up, which means more and more information is to come. The next thing that I also intend to do is to sort of do quantifying the queries about the prevention, the causes, the spread, and the treatment. And that, in a way, I believe will help to know where more effort is needed, if I may say, in that if, let's say, we're getting a lot of questions, that's where the information is lacking, or where information is lacking is where there are chances of people coming up with their own hypotheses, which then brings about confusion. To identify more data sources, because topic around confusion and lack of information is huge, and a lot of things can feed into it. So I'm trying to identify even more data sources to feed into this work. And then also partnerships, in a way that it would be nice to get a choice of this tool that actually uses the findings from it to inform some of their work. Yes, and those are the next steps that I'm looking at to, continue it. I'll take questions from now, and if of those channels for any questions regarding this work. Thank you.
Thank you. Thank you very much, Maureen, and bang on time. Okay, so I hope you can all hear me. Maureen, can you hear me? Elaine, can you hear me?
Sure, I can hear you.
I can hear you.
Okay, so maybe Maureen has. What we'll have is the questions in one big chunk after the visualization and this data gathering talks are done. And thank you very much, Maureen, for that talk. And people, please, if you have questions, I see a few coming in on the Q&A, put them there, and Maureen will have a chance to look at them and answer them during that break. So next, we're going to hear from Osbert, and I'll allow him to take over and share his screen and take it and give us his presentation. So Osbert, please go ahead.
Hello, how are you? I'll just share my screen now.
Yes, go ahead.
I hope you can see it. Is that visible?
Yes, it's good. It's very good. Thanks.
Oh, all right. So thank you all for having me. My name is Osbert Osamai. I am an alumni of the DSA. I attended the Nyeri Summer School, and I really had a great time there. So good to see you all again. I work for a government agency in Uganda that is in charge of supporting the ministries and agencies when it comes to IT. And when this COVID pandemic hit us, we had a couple of challenges. We were not so ready in terms of screening people getting to the country. In as much as we have border control systems, we could not really, use them for the purposes of tracking COVID cases. So that was one of the big challenges. And then we also had, we have testing centers that we set up. However, results, streaming in from these testing centers were not really coming to one central location. So I guess my presentation is really about data collection and a little bit of visualization. I was just thinking to myself, this is not really the kind of DSA presentation, but anyway. Then the other challenge was really, once we had people in quarantine, like the people that had traveled to high-risk countries, and then some that had come home and were quarantined in their homes. So it was really difficult in the sense that some of those people actually interacted with some people. So we needed to also be able to trace the people that come into contact with during that period. And the other challenge was communication around COVID, managing communication and, at a national level, fake news, uncoordinated information. And we had our call centers being overrun, especially the Ministry of Health call center. Yeah, so many calls came through, and this was, it really crashed. So I'll just be telling you some of the things we did around fixing that. And then we also had a big challenge now of fragmented data sources. So we have all these systems in the health sector, or applications, let me say, but most of them could not really exchange data. And so at this moment, it was really difficult to, pick data from all the sources. The other issue we had was a task force was set up by government to handle this whole COVID situation. And this task force usually meets twice a day, but the meetings were taking so long because, information was not coming through. And so there were so many delays in terms of taking decisions. So what we did as government and as an agency supporting the Ministry of Health, we came up with some tools. We call them applications for data capture. And these tools were really in the areas of tracking the people coming into the country at the various entry points, airports, and other border points, recording symptoms, who has been isolated, and things like that. And then the same tools will be used to track the people in quarantine for the 14 days that were set up. So 14 days, what's the situation from day 1 to day 14? Now, in terms of the call center, we had to deploy some bots, chatbots, using some open, some APIs. And these help to beef up the call center to help with, answering a few questions here and there. And also the other thing we had to do in terms of integration, we had to really build a lot of APIs. I don't know, because almost every 1 to 2 days we're, churning out an application, APIs and the like, mobile apps, etc. And then in terms of the knowledge base, we put in place information portals because, when you have a crisis like this, information, where do people go? Which data source or information source do they trust? So we have put in place some portals that can guide people, give them information about COVID and the like. And this is also been implemented as a knowledge base for the call center agents to answer some questions. Now, so really, we came up with a few tools and dashboards, like the one, I hope you're still with me. Hello?
Yes, we can hear you.
Yeah, we
Oh, all right. So
Yes, we are.
like the dashboard you can see there is basically for following up contacts. So some of the quarantine people, having been in contact with other people, we needed to access these contacts and also follow and monitor the situation, monitor their symptoms, monitor them. So this dashboard simply tells the people in the situation room how many contacts are under follow-up and what percentage have been completed and the like. Another dashboard that we worked on, okay, this, I have blocked the names, but this really says that it gives us a number of people who are in quarantine. And this also helps the decision makers in the, in the hot seat to take quick decisions, to, apply resources to different areas. So the names there really of locations, designated areas where the quarantined people are kept. The other dashboard that, now this as it's not very nice looking like Maureen's dashboards, but this is actually the main dashboard that the government is using right now. So even journalists are getting, figures from this dashboard. Confirmed cases so far in Uganda, 52, and then the other details, as you can see. So these are kind of the simple things that we manage to do and ensure that, citizens and other stakeholders can trust one point when it comes to information, and this helps in the fight against COVID. This is just a sample data, capture form for the contacts, and we did so many others like this. So in terms of the takeaways really from what we have done, and I must say that I don't consider myself a data scientist, but in terms of what needed to be done in a crisis like this, we need a lot of what we call DevOps in software and other areas of IT, quick to deliver, quick solutions. So I think generally in data science, we need to ensure that our tools are quick to build, quick to, to put out there for use in times like this. And then again, we always talk about, like, the government of Uganda, we've had so many discussions about integrating our core government systems, including the ones in health. If this had been done at the time, then this situation would have been much easier to handle. And so that is very key when it comes to developing APIs and integrating key data sources. The other issue is about coordinating the teams. And well, I mean, just goes without saying, the teams really have to be in sync. If one person is working on one piece of a solution and you're collaborating, and imagine we're not, we are working from home. So this was one of the things that really needed to have on top. And definitely the issue of scalable data products or solutions. So imagine if the border control systems could easily be enhanced to take care of this pandemic. That would have been much easier. So yeah, we use the normal tools, Python, Django, JavaScript, SQL, and Ionic for mobile apps. And then, so these are the main links the government of Uganda is actually using. So the top one there is the internal dashboards. So that has some login credentials. And then the second one is the general portal for anything about COVID happening in Uganda. And then that's the Ministry of Health website. I thank you all for listening, and yeah, good evening.
Yeah, thank you very much, Osbert. And again, yeah, thank you for sharing with us the efforts in Uganda. That's excellent to hear. The Q&A is still
Hi,
open.
Shira. Can you please upgrade Neil to panelist?
Okay, we'll do. Now, we'll then have a presentation from Paul. I believe you're ready to go.
Yes, I'm ready. Can I share my screen?
Yes, share your screen, and yes, we're eager to hear what you have to share with us. Thank you.
So at the moment, it says that I can't start my video yet. It says the host has blocked my video. But maybe, there we go. Okay, I figured it out, sorry. Okay, let's just open that up. Okay. Hi, everyone. Thank you so much for having me. Just send a message if you can't hear me or if there's any problems there. Thanks very much. I'd like to introduce myself. My name is Paul Kennedy. I'm the community coordinator for Zindi, which is Africa's largest machine learning competition platform. I want to talk a little bit about how we're putting our community to work on the challenges of COVID-19. Just waiting for this. Sorry. There we go. Okay. So I'm starting with this picture. I really love this picture. This is from our recent Umoja Hack Africa, which was a large inter-university hackathon that we hosted across Africa. We hosted it on the 21st of March. And what I really like about this is it just shows the kind of DIY and never say die spirit of our African data scientists who are still always ready and willing to help out in the face of the adversity that we're facing right now. I'm showing this as an introduction because we found that Umoja Hack Africa, although originally planned as a physical event that would happen at the same time across a number of universities, it ended up being a virtual event, and we had to pivot that right at the last minute. It was, universities were closing and governments were issuing lockdowns in the week leading up to the event. And instead of switching the event off, or shutting the event down, we decided to continue. And the event was really a fantastic success. We saw more than 1,000 participants join us on the day. Those were all data science students from 15 countries across Africa. We got more than 2,500 machine learning solutions in less than 8 hours. And overall, it was just the enthusiasm and excitement that people showed despite being stuck at home a lot of the time, and despite difficult internet connections and a lack of processing power. The enthusiasm was quite remarkable. And for that inspired us or made us realize that this was an untapped resource in this time of adversity in Africa, in many African countries and all over the world. We realized we had these data scientists ready and willing to solve problems. So inadvertently, Umoja Africa had served as a proof of concept for how we could go forward in addressing COVID-19 challenges. Just to take a step back, I want to talk briefly about what Zindi is, in case you don't know what I'm talking about. Zindi is a data science competition platform that brings together more than 12,000 data scientists to solve pressing African challenges. There are more than 80% African users on the platform, and we host a wide range of challenges, socioeconomic challenges, scientific challenges, social challenges, basically anything we can get our hands on in terms of data. We host challenges from corporations as well as startups, as well as governments and not-for-profits. And it serves as a place for many data scientists to dip their toes into data science for the first time. So, as I said, Umoja Africa served as a proof of concept for us that virtual hackathons would work fantastically well in this time of remote work and stayaways. So with that in mind, we developed a concept that we're calling Zindi Weekends, which are virtual hackathons that run from Friday noon till Sunday midnight every weekend. The first one ran this weekend past, and we will run one every weekend, hopefully for the next 6 to 8 weeks. Each weekend we plan to have a fresh data set. All of them will be COVID-19 related, and we hope to put people's skills to the test and hopefully, in fact, change the world for the better in this time. So just a bit more information on the challenge that we just ran. This was a hackathon that we called the South African COVID-19 Vulnerability Map. And the challenge was to see whether you can infer valuable COVID-19 public health risk factors from outdated data. In this case, that was 2010 census data from South Africa. And we hope that this would be a first step in building a map of the most vulnerable, despite building a map of the most vulnerable without the need for risky and expensive and time-consuming surveys on the ground. So you can see from the screenshot that we had more than 300 data scientists sign up for the hackathon, with 180 making submissions over the course of the 60-hour event. We're planning a number of other hacks, as I said, one every weekend for hopefully the next 8 weeks. So as I said, we've had the South African COVID vulnerability map. This weekend coming, we will have a challenge to see if our machine learning experts can estimate air quality using satellite imagery. We want to run a computer vision challenge to tell if somebody is wearing a mask in an image or not wearing a mask. We're also looking into using NLP for social listening about COVID-19 using Twitter data. But I think that could, the NLP, it could, the sky's the limit for what you could use NLP solutions for, if you have the relevant data. And then as I say, we're still looking for data for many of these challenges. We'd really like to do some challenges on mobility and how mobility is changing in this time of lockdowns and stayaways. And we would really like to look at economic impacts so that we can start making predictions for governments and for businesses in what is sure to be a difficult time for all of them. We're also running a more, what I would term a more traditional Zindi challenge. Most Zindi challenges run for 6 weeks to 3 months. And one of those challenges that we launched soon after the WHO classified COVID as a pandemic was to predict the global spread of COVID-19. This is in partnership with AI for Development. And what's interesting about this challenge is that we'll be testing it against data that hasn't yet been collected. So we'll close the challenge towards the end of April. We'll give it a month, and then we'll test the machine learning solutions that our community develops in June on a month's worth of data. Once that's done and we've identified the most successful solutions, those models will be used to make predictions about the further spread of COVID-19 over the course of 2020. And we're committed to making those models and the predictions public. And that will be in partnership with AI4D. I think it's an important consideration what to do with the solutions of a hackathon. Otherwise, it's almost just for show. We don't yet know exactly what we're going to do with the solutions. This is, in a way, a kind of a big experiment. We're looking at how or what value we can get out of the cross-pollination between different disciplines and applying machine learning data or machine learning solutions in novel ways to new data. We're thinking of these at the moment as proof of concepts, but we're really all ears. So I'd like to finish by saying, if you have any data that you think might make for a good challenge in this regard, if you can think of something that you'd really like to do with some of these solutions, or if you'd like to get involved in any way, please reach out. Zindi's committed to making the best use that we can of this opportunity that we have. And I'll take questions, I guess, at the end. Thank you very much.
Thank you very much, Paul. Thank you for that. I wanted to ask if the next presenter, Darlington, is on. If you're among the attendees, please raise your hand. If not, what we'll go is go directly into the panel and roundtable. I believe all the presenters are there, and we are bringing on Bright Onapito from Uganda, who is also going to share a bit of his experiences in collecting data as part of this panel. Is Darlington around? Okay, so I assume not. Then I guess I'll ask Billy. Billy, are you? I wanted Billy to go ahead and chair this session. Billy, are you online?
Yes.
Okay, so take it away, because we have, what I'll do is I'll ask all the presenters, Osbert, Paul, Maureen, and now Bright. Maybe Bright, are you in a position to share a little bit of your experience in maybe the first 2 minutes, and then have then Billy we can have every participant is able to share some questions on the Q&A, preferably the Q&A or the chat, and then we can we can have the speakers answer.
Yeah, hello, can you hear me?
Thank you. Yes.
Right.
Oh, can I go ahead and share?
Yes, you can.
Okay, thank you. My name is Bright from Uganda. And I'm just going, in like 2 minutes, I'm just going to share what I've been doing regarding especially collecting data on COVID-19 in Uganda, and also trying to visualize this data. Okay, let me just set up my, yeah, so of course, we all know how COVID has been ravaging the world. So I decided to, because I noticed there was not a lot of data I was seeing on Uganda. And I know the Ministry of Health, together with the National Health Authority, OSBAT works for them. And I sometimes do work with him as well. I've been collecting data and doing some work. But since that was not yet public, I decided to go ahead and start collecting data, mostly from crowdsourced channels, especially Twitter, from press releases from the Ministry of Health. And so since the outbreak began on the 21st, I began collecting this data. And I think the data is quite clear. We have 54 confirmed cases in Uganda, no fatalities yet. And I was very interested to see how Uganda was faring vis-a-vis the rest of the world. Looking at the 5 most hard-hit countries, you can see their statistics, the case fatality rate, that's the people who are dying from the virus. Compared to Uganda, I could see that for Uganda's numbers are still low. And I was trying to understand why is it that our numbers are still low. And of course, from the research that is out there, we know that people who are seniors in age are more likely to contract the disease. And of course, if they have underlying conditions, so younger people are less likely to die, not less likely to catch the disease, but less likely to die from the disease. And Uganda's population is 76% are below the age of 30. So that gave me, it's helping me to understand why so far we have not registered any fatalities. So that is just a comparison of the confirmed cases vis-a-vis our national population. As you can see, most of the people are below the age of 30. And this is data from a report that was released by WHO in conjunction with China. And it just says what I just said. Most people who die are between the 60s, 80s, 70s, and 80s. And the younger people are less likely to die. It's interesting that this week there have been registered fatalities of people who are of children. There was I think a 6-week-old baby in the US and a 14-month-old child in India today. And again, it looks like most people who are contracting the disease are in their 20s. So I compared Uganda with Australia, South Korea, and a host of other countries, and looks like the data seems to be consistent. So I was interested to see where most of the infections are coming from. That is within Uganda. And from the data that has been released from the Ministry of Health, most of the infections have come from Dubai, the United Kingdom, USA, and some other places. So that has made those countries, of course, high-risk areas. And as OSBAT probably already mentioned, there are already measures to isolate people that have been coming from those countries. And looking at the cases within the country, how they are spread out, most of the cases are within central Uganda. That is Kampala, Wakiso, Mpigi, Masaka. These are places within central Uganda. And it would be interesting to know whether there will be new cases breaking out within the community. And I think of the confirmed cases that we have, there have been maybe 3 or 4 cases that have been within the community. That is people that caught the disease from people that had traveled. So it'll be interesting to see how those cases are going to spread. But considering the fact that there have been a lot of measures to contain the spread, we can see that from that graph, the spread, the new cases are being reported are very few. This is just after 18 days. So it'll be interesting to see what it's going to look like after 21 days, because looking at data globally, after 21 days, the cases shoot into the thousands, and then things seem to spiral out of hand. So it will be very interesting to see how things are going to move in Uganda, especially. So this is just a summary of what I've been doing so far. I created a track. I'm collecting data, like I said, from crowdsourced channels, and hopefully it's public and it's actually visible online. I put it. I have a dashboard that I created, so you can easily see what's happening. Yeah, so that's just a summary of what I've been doing so far. And yeah, thanks.
Thank you very much, Bright. And maybe you can share some of those links on the chat. You can share them with the attendees and people. The next session will be chaired by Billy Okal, who's on the organizing committee of Data Science Africa, and we'll invite questions from all of you, and the panelists will answer and have a brief discussion for the next 20 minutes. So, Billy, take over. Thank you.
Hi, everyone.
Hi.
So we've had some wonderful presentations already. Thank you for all the presenters so far. This has been enlightening. It's good to see a lot of great work already happening, even though there's a lot more to do. So for the next 20 minutes, before we hear more from an epidemiology side and also from other speakers, we just want to take this break to allow the audience to get a few questions in, get some reactions. So to make this civil and easy, there's a mechanism to raise hands, but I think it would be easier to just type in the questions on the Q&A, Shira, and then you can direct the question to whoever you expect to answer, or we'll ask all of the presenters to chime in. So we have one open question in the Q&A directed at Maureen. Maureen, do you mind chiming in on the current question on how if somebody can use keywords from Google and Bing in some restricted region?
Let me see. So the first question that I see that was mine was if these searches can be drilled down to country level searches. And yes, for the results that I actually showed you in those visuals, that was only for Uganda. So you can specify the country for which you're interested in getting the search queries, and you narrow down to that specific nation. I don't see the question that you're talking about, Billy.
The question is from Ismail Kone.
Is it in Q&A or in the chat?
In the Q&A.
Okay, could you just read it for me because I can't see it.
So the question is, hi, Maureen, thanks for the presentation. Please, can user search keywords found from Google and Bing be restricted to some region so that we can know people where is interrogation from a given country?
Can I share the keywords? Yeah, I didn't get the question.
Are you on? Is Ishmael around to clarify? I think you probably already answered the question. I mean, the question is, how can you localize this keyword search to a particular region so that it's more, you know, your analysis is a lot more localized? And I think you already answered yes, if I'm not
yes.
misparaphrasing.
True. Yes, I already answered that. Thank you.
Any other questions on the chat or on the Q&A? While we wait for other questions, I have a question for all the presenters in general. There's all this data gathering and dashboards and presentation. What's your perspective on veracity? At some point, the question comes, which dashboard and which data source should people look at? And with the proliferation of many dashboards, how does the problem of veracity get tackled in this case?
Well, if I can answer that, for us as government, we have procedures. Like when we had this COVID crisis, we put up a task force chaired by an army general, among other things. But we have a way of, saying everything comes from the Ministry of Health. So if this dashboard is for the Ministry of Health, this is the one we're going to trust. Only the minister will give updates, or only this person will give updates to the president. You can see our president has been on TV almost every few days, so he's taken charge. So I think for us in government, it's not that difficult to say this is the official dashboard.
Thank you. Any other presenter wants to chime in? Well, we got a few other questions on the Q&A. So Osbert, before you go, there's another question for you. It is asking, does NITA have an open data API specifically for cases coming from Uganda?
Well, open API, no, not as such, but how can I put it? So we get these numbers from the Ministry of Health, and in any case, since we've helped them develop the applications, it will be a matter of extending that. But perhaps as we speak now, no, there's no public API really that other systems can use to pick this. But that's something we can do.
Fantastic. It's good to know that the government is working towards this direction. Yeah. There's a question here for Bright from Francisco. So the question is, just in case people can read it, thanks for the information, Bright. Would you happen to know what the current testing capacity for Uganda is? There seem to be few deaths, but could the small numbers in cases also be due to limited testing?
Thanks, Francisco. I think Osbert can help, can correct me if I'm wrong. I know that they test between 150 to 400 patients every day. Of course, not patients, but suspected cases. Because we've been having about over 1,000 people in quarantine since over the past 18 days or so. So they release the test results every day. So it's about, because the number of people that were put in quarantine were not so many at the start. But I know there's an effort in the next 1 week to identify another, I think there are more than 2,000 people who are contacts of the people that came into the country. So the testing is only for suspected cases for now. We're not doing mass testing as a country. So I think, of course, the challenges with getting test kits globally. So it's being restricted to the people who are in quarantine so far. Yes.
Yeah, Bright,
Thank you.
I think you're spot on. We are giving priority to really those people with symptoms that look really to be, close to COVID. And as you said, it's not very cheap to carry out these tests. So the focus has been on those and then the contacts, but I think we're managing well.
Yeah, that's true. Can I see another
Thank
question?
you. Yes, there's another question for you, Bright, before you go. Should I read it out just in case? So what are the challenges of crowdsourcing your data in terms of source of accuracy and robustness and the size of the data sets?
Yeah, the challenge is the data sets are not publicly available. So I have to rely on the competent authority, who is currently the Ministry of Health. So what happens is every other day they release a press release of the confirmed cases and the cases that have been tested and the ones in quarantine. So it's only as accurate to the extent that I get it from the source, from the competent authority. So I take the data of what, usually it's a Word document. I have to type it into Excel. I mean, I have a web app, so I just punch in the numbers and then some computations up to the visualizations. So of course it's challenging because I have to keep I have to monitor the Twitter accounts, especially because most of the press releases come from Twitter. So my data set currently has about 52 data points, and it's most likely going to increase. So yeah, so those are the challenges so far.
Thank you. There's another question from Anonymous. I'm not sure if it's directed to you, Bright, as well. It says, how do you mention you have done work with Twitter data, just like you but said? Are those findings from Twitter or the Ministry of Health website? I don't know who this is directed to, but Bright, can you answer that from your side?
Yeah, sure. I'm not doing any actual data mining using maybe NLP to pick that data. No, I am actually, I have alerts on the Ministry of Health Twitter account. So every time they tweet something, I pull down the information and manually enter it into a worksheet. So this is an official communication channel of the Ministry of Health that I'm using to get my data points. From time to time, the president will have a press conference, the Ministry of Health will have a press conference, and they'll divulge more information. And I use that time to collect information, because sometimes not all of it is put in a presser. So that is how I'm getting my data of Twitter for now.
Billy, if I may, and since we are DSA and I am directly in charge of the development of some of these platforms, I'm going to make it a point to ensure that we put up an API for COVID.
Yeah, that would be good. Yeah, okay. Yeah. Good stuff.
Thank you. There's a question/comment from Charles. Charles, do you mind commenting out loud?
Okay, in the meantime, I've just allowed him to speak, so we needed to do that in advance. There are some questions also coming in on the chat. For example, John is asking something about social media. And does anyone from the panel have any thoughts on using social media data? For example, could there be methods to track rumors or misinformation? I think maybe Maureen can comment on that.
I was happy to jump in. I would say I'm no expert on using social media data. We're very keen on doing some kind of NLP based work using social media data. That's the problem is always about getting hold of it. You have to jump through hoops a little bit, particularly with Twitter. But Zindi would be very interested in looking at rumor tracking or misinformation tracking. That's actually a fantastic idea. So I'll definitely put it to the team and see if that's something that we can pick up.
Great. Sorry, Billy, to jump in again. There is also another question from Elaine. There are questions coming in from YouTube. So this one is directed to us, but what kind of data from what kind of laboratory data is the Ministry of Health collecting?
I think to say is apart from laboratory data, what other data? But quite a number, like I mentioned earlier, we are collecting data on who is in quarantine, who is coming to the country, what are their symptoms, because in as much as we've closed the borders, we're still allowing in cargo. So there's still flights coming in with cargo and also trucks coming in. And there's also, we are monitoring reported cases. We have people that call, the call center reporting cases here and there, symptoms. So all that data is being collected. And like I said earlier, we are trying to have all that in one place for easy analysis.
Hello.
Yep.
I think regarding the multivariate analysis, I am not certain that anyone is doing that kind of that level of analysis so far. So I think this will be a good place, a good opportunity for us. I don't know if to work with the Ministry of Health, if we have the expertise to see how we can, to help beef up their efforts to analyze this data for purposes of containing the spread of the disease. So I think this is an opportunity in summary.
Bright, if I may say something on that, in as much as I made this presentation, it's really from the side of developing the tools and handing them over. But I know that the epidemiologists, is that the word, are doing more work with the with the data that they're collecting on this platform. But that's something we can explore, like you said. But definitely, there are some other people inside the ministry that are doing, further analysis. Shira?
Thank you.
So
we are about close to wrap up the Q&A. We still have a few more minutes. Any other burning questions before I switch to the next stage?
Mine is not a burning question, but I wanted to comment about John's question about if anyone is looking into social media. Martin and we're doing some work as Pulse Lab Kampala about, we're just exploring. It's not yet, a concrete project, and maybe we thought we would talk about it in the next session.
We're
looking into data and specifically look at conception. Hello? Can you hear me?
Yes, Maureen, we can hear you.
Yes.
Yes, we can hear you, Maureen.
Yes, so I was saying that as Pulse Lab Kampala, we're looking at some misconceptions and rumors and myths that are going around on social media, and specifically Twitter. But like I said, we're still exploring to see if there is potential of a project, and we will probably talk about it more in the next session of once, if we will have another one as Data Science Africa. But yes, we are looking into social media data and even radio as well. But the work is just starting.
Yeah, we've also been collecting data from social media to look at response to interventions such as lockdowns and school closures and things like that, and also misinformation as well. So it'll be good for us to link up and collaborate in some of these efforts.
Thank you, Elaine. Any final remarks before we introduce the next speaker?
Maybe I'll jump in and take advantage and ask a question. I noticed that this is to the speakers in this previous session. A lot of, I guess maybe the gold standard dashboard seems to have been this dashboard from Johns Hopkins University, and that's where a lot of people seem to be citing their data. It's coming from there, and they are also getting, they're getting data, I guess, from other sources, but they seem to be getting it directly and very quickly. I wonder how is such a link set up? How is it that that they are able to get data in collated in that way? And how would, if we were to do something on the African continent, how would we replicate that?
Shira, your question is a bit tricky, but I don't know if you're asking how they're able to get that data from the source. Probably, like, if I may, the health sector works very closely with development partners, and the likes of UNICEF, USAID, CDC. I would just guess that because even in Uganda, you come to the situation room for COVID, there's a CDC representative who is very key in the situation room. And if you have the CDC at the Ministry of Health, and perhaps they have a good relationship with Johns Hopkins, then you can imagine all the CDC representatives in the different countries being able to give them that data. I don't know if that's where your question is coming from.
Yeah, it really, that's thank you for that answer. I was just curious about that.
Shira, before you introduce the next speaker, there's one last question. I don't know if you have time for that, from Benjamin. I think it's an important one. How is contact tracing being done currently to track down potential asymptomatic cases? And this is to all the panelists.
I can jump in from what little I know in South Africa. Our sister company, Ixio Analytics, has been assisting government with that. And I know, I don't know much about it, but I know one of the primary ways that they're using contact tracing is using data from the big telecoms, so Vodacom, MTN, Cell C, to understand exactly people's points of contact. But yeah, that's a very little bit of the picture, I'm sure.